Zoonotic and vector-borne diseases, which we will define later, have substantial environmental components and can contribute greatly to society's burden of death and illness. Medicine and public health has made great strides toward the control of infectious diseases within the last 2 centuries. In fact, by the mid 1960s, some health authorities proclaimed that society was moving toward the virtual elimination of infectious diseases as significant causes of morbidity and mortality. However, with some of the changes in climate and the expansion of the human population, we are now seeing more and more emerging infectious disease threats. This indicates how much environmental health is impacted and impacts disease. Zoonosis is an infection or infectious disease that is transmitted under natural conditions from vertebrate animals to humans. Examples of this are cats that have rabies and toxoplasmosis, dogs that have rabies, parasites, and Campylobacter. Farm animals in general have anthrax, brucellosis, E. coli, Q fever, and crypto. Poultry can have avian influenza and salmonella. Bats, wild animals like bats can have rabies. Bears and wild hogs can have trichinosis. Birds can have cryptococcus, and mammals like beavers, bison, deer, foxes can have rabies. Rodents can have the hantavirus, tularemia, or even the plague. When we talk about vector diseases, these are diseases that are transmitted to humans by an insect. A vector-borne infection usually involves a complex life cycle. Transmission of the infectious agent to a susceptible host is the start of this by bite of blood-feeding arthropod or vector. And there are many examples of this. Malaria, which actually comes in 4 different types, Falciparum, Vivax, Ovale, and Malariae, is caused by a plasmodium, which is the causative agent, and it can actually be life-threatening. It is transmitted to humans through the Anopheles mosquito when a bite occurs. The name malaria originates from an Italian word meaning bad air. Originally, it was believed that malaria originated from the dank atmosphere around swamps. However, what was really occurring were mosquitoes were laying eggs in the stagnant water in the swamps. In the United States, malaria was endemic until the end of the 1940s. An anti-malaria campaign was launched in July 1st. One of the major activities consisted of spraying homes with DDT. DDT was actually highly effective in controlling the mosquitoes that transmitted malaria. However, DDT was found to be harmful to many bird species and other species of wildlife, so the use of DDT was eventually opposed by many developed nations, especially the United States. Discontinuance of the spraying and mosquitoes' development of insecticide resistance are among the factors that are believed to have contributed to the resurgence of malaria-bearing mosquitoes. Another disease caused by the bite of an insect is the bacterium Yersinia pestis, which causes the plague, actually comes from the bites of fleas to humans. Mice and rodents carry the fleas, which then bite the hikers. We find this in the Southwest a lot, and actually a natural reservoir are wild rodents, but it also can harm house cats and dogs, which may bring it into homes. Lyme disease is a condition that was actually identified rather late in 1977 when a cluster of arthritis cases occurred among children around the area of Lyme, Connecticut. The causative agent for the disease is a bacterium known as Borrelia burgdorferi. Transmission of Lyme disease to humans is associated with infected blackleg ticks, that ingests blood by puncturing the skin of the host. Tick bites can also cause other diseases such as Rocky Mountain fever. Arboviral diseases denotes viral diseases that can be acquired when blood-feeding arthropod vectors, such as mosquitoes, can infect a human host. Typically, the complex cycle of transmission involves a non-human vertebrate, which is a reservoir host, such as a horse, and an arthropod or mosquito vector. Examples of these are West Nile virus. In order to stop the spread of West Nile virus, it is recommended that you do not leave standing water anywhere, as mosquitoes find this as a great habitat to lay eggs. There are a number of emerging zoonoses, like we discussed at the beginning of this session. And with the emerging and re-emerging infectious diseases, we have to consider several factors that might be contributing to them. The migration of human populations within tropical and semi-tropical areas increases in international travel. Population growth with attendant crowding and urbanization, overuse of antibiotic and pesticides, lack of clean drinking water, and climate changes attributed to human activity all increase the chances of emerging infectious diseases. Two of the emerging infectious diseases that you may be most familiar with are the Zika virus, which is mosquito-borne, that causes microcephaly in fetuses, as well as Ebola virus, which we tend to have outbreaks in the DRC quite frequently, which have actually reached the United States. The condition that is caused by Ebola is known as a viral hemorrhagic fever, and it refers to a dramatic, highly fatal, and acute disease associated with the infection. It's in a group of diseases known as Ebola-Marburg viral diseases. Symptoms include fever, headache, diarrhea, vomiting, and may also involve internal and external bleeding. Other diseases that are now re-emerging are Mpox. The first outbreak of Mpox actually was in 1958. Our most recent outbreak actually has lasted over a year, and the transmission of the virus is much different than transmissions that we have seen in the past. Tularemia is a bacterial disease associated with rabbits, and you can find it in the United States except Hawaii. And rabies is an acute and highly fatal disease of the central nervous system caused by a virus transmitted most often through saliva from bites of infected animals. Globally, dog bites are the principal source of transmission of rabies to humans, a disease that affects mammals. It causes encephalopathy and paralysis of the respiratory system. One of the most concerning, especially after COVID-19, of the re-emerging diseases that we should always be looking for is highly pathogenic avian influenza. These are strands of flu that are found in wild birds. The wild birds then, through migration, transmit it to poultry factories and backyard flocks. When this occurs, humans have a greater chance of coming into contact with a new or novel flu that has mutated, that it might not match the vaccine, and it might not be one that has challenged us before. There's always the risk that this can become transmitted from human to human, which would then lead to likely either a outbreak, epidemic, or pandemic of flu. Most recently, in 2024, HPI actually was found in dairy cattle, marking the 50th mammal that avian influenza has been transmitted to. Heavy metals in the environment are another agent that can cause negative health impacts in humans. These are lead, mercury, and nickel, and other metallic compounds like aluminum, iron, and tin, which actually can be found widely dispersed in the environment and arise from both natural and human-made sources. Examples of this are lead and mercury. Lead can be found in paint in old houses, and mercury can actually be found in fish, leading to messages of reducing intake. Heavy metals can be found in a number of different media, which can lead to the potential exposure of a population to a heavy metal. This includes water, soil, air, dust, and basically anything organic. Industrial plants, common industrial processes may release toxic metals in the air, which impinge upon nearby residents and passersby who are actually unaware that they are breathing fumes that contain toxic metals. Tires is another potential way that people can become exposed to heavy metals, as well as the disposal of electronics. Exposures to toxic metals can be either acute or chronic. Chronic exposure to toxic metals chronically usually are found within occupations or people that are exposed over and over and over again. Acute exposures happen once or a lot less frequently. The symptoms actually depend upon the population, the length of exposure, and the type of chemical. There are vulnerable populations when we think about toxic metals that we should be most concerned with. This frequently includes children from a developmental standpoint, older adults from a fragility standpoint, and then pregnant women because of the development of the fetus. Hazardous chemicals are another agent found in the environment that can impact human health. They are everywhere and actually a vital component to society. Pesticides are one example of hazardous chemicals that can impact humans in a negative way. Spraying pesticides around people's residence is actually a method for controlling invading pests and stopping the spread of diseases or the destruction of crops. This is a vital need that society has found for pesticides. However, they can have very bad impacts if they're not used properly or appropriately. The most likely to experience harmful effects of pesticides are agricultural workers and people that unwittingly expose themselves or misuse them. Pesticides used in agriculture may have undesirable effects upon cattle or other livestock. Exposure of livestock to pesticides may come from contaminated feed. The widespread application of pesticides to food crops could have unintentional and adverse effects on helpful insects, because there are some insects that are helpful. Colony collapse disorder occurs when worker bees abandon their hive, leaving behind the queen bee and young bees, resulting in an eventual death of the beehive. Scientists in the United States observed the deaths of 30 to 90% of beehives during 2006 and 7 due to the use of pesticides. Dioxins are another example of hazardous chemicals that we're often exposed to. It's usually a byproduct from either natural or industrial processes. Unfortunately, it takes years for dioxins to decompose. It also takes years for polychlorinated biphenyls to decompose, and they persist for long periods in the environment. These are used for insulating fluid. Organic solvents, they actually dissolve other substances. We can become exposed to this through breathing vapors, food and water, and different cosmetics and plastics actually contain organic solvents. There are a lot of chemicals in plastics. These include styrene and vinyl chloride, and these can have negative health impacts on humans. There are a lot of household products, mostly cleaning products, that include harmful chemicals that are found in plastics, such as styrene and vinyl chloride. Ionizing radiation and non-ionizing radiation can also impact human health. Ionizing radiation occurs when electrons have so much energy in a molecule that they move or displace other electrons, which can actually cause harm to human DNA. Non-ionizing radiation occurs when the electrons vibrate but don't completely move or displace other electrons. When we talk about ionizing radiation, we think about radioactivity and also radioactive decay. Alpha particles, beta particles, gamma particles, and X-ray are all forms of ionizing radiation. When we talk about nuclear power plants, this is a potential source for exposure of the population to ionizing radiation, which also includes weapons, production plants, test sites, and nuclear power plants. Some of the examples of other examples of ionizing radiation are uranium, radon, and extraterrestrial radiation. When we talk about the effects of radiation, we need to think about the time exposed, distance from source, and the degree of radioactivity, because this will tell us what our health impacts likely are. Natural occurring forms of radiation include uranium, radon, and extraterrestrial radiation. Again, a reminder that nuclear facilities, including nuclear power plants, always have the potential for fallout and can be used in dirty bombs. We also need to consider the use of radiation in medical devices because this can have an impact on human health and moves us to use radiation in the least amount that will do the best good for our patients. Some forms of non-ionizing radiation can also be harmful to humans. This includes extremely low frequency radiation, which is wiring, electric poles, or electric appliances that we find within our homes. Microwave radiation from our microwave is also a type of non-ionizing radiation. And the one that we're all exposed to is UV radiation.